Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on Loperamide tablet, exploring the various aspects of Loperamide, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Loperamide tablet. Loperamide is a medication primarily used to treat diarrhea. It belongs to the class of drugs known as antidiarrheals. It is commonly available over the counter in tablet form and is also found in combination with other medications in some formulations. Next, dosage of Loperamide tablet. The dosage of Loperamide tablets can vary depending on the individual's age, the severity of diarrhea, and other factors. However, the typical recommended dosage for adults is 4 mg initially, followed by 2 mg after each loose stool, with a maximum daily dose of 16 mg for over-the-counter use. It's important to carefully follow the dosage instructions provided by a healthcare professional or on the medication label. For children, the dosage is usually based on their weight and should be determined by a healthcare provider. Next, mechanism of action of Loperamide tablet. Loperamide works by slowing down the movement of the intestines, which helps to decrease the frequency of bowel movements and make stool less watery. It acts on the opioid receptors in the intestines, reducing the muscular contractions that propel food and waste through the digestive system. This results in increased water absorption from the intestines, leading to firmer stools and relief from diarrhea. Next, side effects of Loperamide tablet. While Loperamide is generally safe when used as directed, it can cause side effects in some individuals. Common side effects may include constipation, abdominal cramps or pain, nausea, dizziness, drowsiness, and dry mouth. Less common but more serious side effects may include allergic reactions such as rash, itching, or swelling of the face, tongue, or throat. Severe abdominal pain or bloating. Signs of dehydration, such as extreme thirst, dry mouth, or decreased urination. Rapid or irregular heartbeat. Fainting or lightheadedness. If any of these side effects occur or persist, it's important to seek medical attention promptly. Next, important advice for using Loperamide tablet. Use Loperamide only as directed by a healthcare professional or as instructed on the medication label. Do not exceed the recommended dosage or use Loperamide for longer than recommended without consulting a healthcare provider. Loperamide is not recommended for use in children under 2 years of age unless directed by a doctor. If diarrhea persists for more than 2 days or is accompanied by high fever, bloody stools, or dehydration, seek medical attention promptly. Drink plenty of fluids to prevent dehydration while using Loperamide. Avoid consuming alcohol or other medications that can cause drowsiness while taking Loperamide, as it may increase the risk of drowsiness or dizziness. Store Loperamide tablets at room temperature away from moisture and heat, and keep them out of the reach of children. Always consult a healthcare professional if you have any questions or concerns about the use of Loperamide or if you experience any adverse effects. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking Loperamide tablet. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.